I have an international background anyways. I was vice chairman of the European Commission for back pain, and so I had a lot of international exposure. We had patients actually from India coming over to us to Germany, and they told us that there is nothing like our German concept here in India. So we came over, started talking to hospital chains. There's a huge gap in rehabilitation here in India. The government estimates the need for therapists in the range of 1.8 million, and the existing numbers are in the range of roughly 50,000 therapists for rehabilitation in India. That's just the sheer numbers. Also, the training of the therapists is not really what we have in Europe. There's not enough training in manual therapy. There are some areas where it's being taught, but not enough. There's no real strong training in the medical training therapy, as we call it. That applies to sports medicine as well as to dealing with chronic pain patients. Protocols that are being used for musculoskeletal patients for sports medicine are not really elaborated. So a lot of therapists are still using a lot of passive therapies only. So you get IFT, laser, ultrasound. Some of these things are not even taught anymore in Western schools because the effect is so limited and it doesn't involve the patient actively enough. So there needs to be a change in the protocols as well, and we are doing that, as well as a change in the collaboration between the medical doctors on one side and the therapists on the other side. They really need to work together to improve the patient's function. We started with our first team in 2012 with 6 therapists and 1 medical doctor, and we had German therapists over for training, and we had German therapists over continuously here to set up the protocols. It took us about a year, 1.5 years, to really establish this thinking and the skill set here and the smooth working. And now we have in Vasant Vihar 1 medical doctor, about 30 therapists who are closely working together. These therapists are from a variety of fields and expertise. So we have generally the musculoskeletal therapists and the neurotherapists, and in that we have a lot of specialties. So craniosacral therapy, visceral osteopathy, we have therapists who do energy work, but most of all, we have all therapists really skilled in good manual therapy and also in the medical training therapy, meaning that we try to gradually improve the patient's function. And this is a main feature parallel to the work of the orthopedic doctors, whether it's with surgery or without surgery. We do the part to really bring patients back into function. We have continuous training. We do a lot of psychological training for the therapists because the psychological part is an inherent and very important part in the interaction with the patients. We do a lot of active therapy, what we call passive therapy, as in ultrasound modalities. We do use, but it has a much smaller amount in our work than the real hands-on work on the patient and then improving the patient in the function. We have a lot of patients who are with us for a long time because the amount of what we call deconditioning, the lack of physical functioning of patients, is often huge. So many patients, for example, who come with neck pain or lower back pain have not only very weak muscles, they don't even know how to use their muscles. So we have to re-establish that first, and then we gradually build them up. And the important thing is, when we build people up functionally, they also reduce their pain. So improving activity is also desensitizing, has a very strong desensitizing effect. So we will not only make people more stable in their muscles and in their loose neck joints, but we also make them more stable in a neurophysiological way. And that's another part that is very important for chronic pain management next to invasive therapies or the medication. The gradual and the proper functional improvement is very important. And this applies to sports medicine. Of course, we want to improve sportsmen. We have many sportsmen here with us. We have all the varieties of golfers, from the amateur to the professionals, and sports people from many fields. But it also applies to chronic pain patients. You really need to look at what can they do, how can they use their body in a proper way to help themselves out. Next to the experience and the skill set of the therapist, we have the modern European rehabilitation devices for building people up, for building up the neck, building up the back. In specific protocols, we both test people and then we gradually build them up. So the majority of our rehab devices comes from Europe. We also have a very strong nutritional program here, Metabolic Balance. We have the Indian license for Metabolic Balance, and we can sub-license people here. A very effective and very good nutritional program that works very well together with our other improvement of function. So we try to really do a full holistic treatment here and help people up in many ways. It is important to mention that we do not only train people initially to get them to the job. It usually takes us 2 to 3 months to train even masters of physio to be eligible to treat patients. We have then a continuous program to really improve their maturity as therapists with respect to the interpersonal relations as well as to the therapy expertise for the next couple of years. We are first movers in this field, and that brings some challenges with it. So this is the training of the therapists. It takes a while until the therapists are getting used to this approach. It's very often the mindset of the patient. The patient comes in with a more passive mindset. I want to be treated, but I don't want to do that much on my own. So this has to be changed. And also we need to change the mindset of the medical doctors. A good rehabilitation is a very powerful tool, both after an orthopedic surgery, after a neurological disease, or in a chronic degenerative neurological condition. So we can, for example, we can help Parkinson people a lot. They start stooping. We can open up their thoracic spine. We can build them up. After a stroke, good rehabilitation to the point is very important, very early, to help people up, and then help them long term. That is very important. Interestingly, people are the same all over the world. So I see the same patterns in chronic pain patients, for example. I see the same sports medicine injuries. I see the same psychological, emotional, or cognitive issues in pain. So that is the same. What is more pronounced in India is that many people have a huge lack of awareness about their body. So we see many people who are very good, very smart brains. At the same time, their physical body has not gotten that attention. Or putting it in sports medicine, the golfers, you see many Indians with very good hands, but they're very often weak and not well balanced and built up in their trunk. So the physical body has been underused, underutilized for a long time, and it takes a while to get patients back to that. And patients have to understand that if you haven't used your body for many years, or you have had chronic pain for 3 years, 5 years, and gone down in your daily function, that it takes a couple of months to actually get you back there. So the telling people about the time frame of change and that they are part of the change. It's not only the doctor's part, the patient is part of that change. That takes time to convince and work with people. But we do take our time with patients, so every doctor has an initial consult of at least 30 minutes. The therapists take their time and they know about the involvement of the patient. So we are overcoming this challenge, but that mindset on the patient side, as well as sometimes on the doctor's side, has to be improved further on. There is a mismatch between the mind and the body in a way that it's very, in my humble Western view, it is very often looked at that the mind controls everything and the body just comes along. My personal point of view is that the body is an important player by itself, and we are a unity between mind and body. That's the true psychosomatics. Psychosomatics is not up there, it's both sides. And we see that every day when we improve patients in their daily function, their immunity improves and their mood improves. So we have so many people coming in stooping, sitting like that, and I have chronic neck pain, of course, and then we open them up, start training their muscles in a proper way, in a dynamic way. It's not enough to do a bit of isometrics here. We need to do that in a real professional way, and then they open up. You have a different outlook in life, whether you are here or whether you are here. So there's a feedback loop there, which is very important, I find, and we realize that patients understand this. We have 4 centers now in the NCR region. We are just in a funding round and we are going to expand here. So we will first expand further in the NCR region, and then by next year we will proceed to other areas in India. We are ready to grow now. We have our protocols all set. However, it is very important for us that we always maintain the quality. I'm in that sense German, that I really want to have the proper quality. The medical doctors need to be trained, the therapists need to be trained properly, and they have to provide that quality and that honesty all over. And we are really committed to doing that. And it's actually an exciting task to develop this in India. And it's very much needed, and it's very rewarding to see how we can make a difference and how we can change patients' life and really make a difference. Sports medicine is coming. It is very fragmented so far. So you have individual stars and individual good therapists, individual very good doctors, but in a broad range, there has to be a lot of development to be done. This starts with screening youngsters at a certain age and then training them up and looking at the medical part in that, and also the medical doctor's part. So how can you train a youngster with specific condition, like a slight spondylolisthesis, for example, and can he still play cricket? Can he still be a good swimmer? So there are small areas here, but this has to be developed in a more systematic way and in a larger way. And again, for this, the skill set of medical training therapy to really bring people up is very important. I had a grant in Germany for 5 years. That was my entrance to sports medicine, on muscle function of elite sportsmen. So coming from the classical orthopedic side then to muscle function was an important thing. And I learned a lot about how often sportsmen who are actually performing well could improve much more if their specific issues would be resolved and would be helped with. So not only from a treatment point of view, but also from a performance enhancement point of view, we can do a lot here. Affordability is an important issue here in India, and we have to apply specific protocols that match many people. This is the way we are going at right now, that we can open up to a good, affordable healthcare. It requires certain protocols, and it also requires therapists to be very well skilled. So it is sometimes better to have only 4 to 5 sessions of therapy of 30 minutes, very targeted to the point, rather than having 20 sittings that do not help. So the skill set of the therapists, which includes what is called clinical reasoning, is very important. And then things become affordable. However, for some therapies, you need specific devices, and you need modern rehab equipment as we have it here. It comes with a price, so it cannot go too low in the price. People have to accept that there's some element of rehabilitation that costs something. But for many surgeries, the rehabilitation is 50% of the job after the surgery. So to come to a normal result, to a good result, and then you would need to accept that it may cost 10-15% of the whole amount to put into that. That mindset also has to change. Another important field is chronic pain management. Many doctors are very well versed in the medical side of pain management, be it in injections, in the medication, but pain management has a very important element of improving patients' function. Somebody with what is called a fibromyalgia, for example, or a chronic neck pain, chronic back pain, they need to gradually improve their function. You cannot wait for the pain completely to subside and then expect somebody does his activities of daily life. We found that in the European Commission for back problems, that the enhancement of function on a very early stage is very important as a second piece next to the medication side. So this is also something that needs to change in the mindset of the whole environment here.